That this House has considered the impact of the tapered annual allowance on members of the NHS pension fund. This issue is one that I've been aware of for some time, both as a local MP but also as a former pensions law practitioner. But it has come to light through the work primarily of the journalist Josephine Gumbo at the Financial Times that this is significantly more widespread and with much more serious implications for the NHS than I had originally understood. Now, I don't want to take up too much of the House's time on what the annual allowance taper is and how it works, partly because it's boring and incredibly complex, but I think a small amount of background is needed before going on to explain why this is an issue in the NHS and the consequences that seem to be flowing as a result. The tapered annual allowance was introduced from the 6th of April 2016 and in short meant that from the 16-17 tax year, a reduced annual allowance may apply to all pension savings by or on behalf of a member depending on the level of taxable income within the tax year. This applies to individuals with a threshold income of over £110,000 and adjusted income of over £150,000. For every £2 that an individual's adjusted income goes over £150,000, their annual allowance for that year reduces by £1, and the minimum reduced annual allowance you can have is £10,000. It will not be a surprise to learn that the calculations of threshold and adjusted incomes are not in the least bit simple, are massively confusing, and make it very difficult to predict what tax bill will actually be incurred. And because it cuts your annual allowance for the current year, you have no idea how much pension saving you can make.
The Financial Times reported that some doctors, GP, dentists are receiving a potential tax bill of some £80,000. So does the honourable gentleman feel that there's a duty on ourselves and on the Minister and this government to ensure that our NHS staff have all the information and access to help them to ensure that no one faces any unexpected tax bills?
I thank the honourable gentleman for that intervention. He's absolutely right. One of the key issues with this is that because it reduces your tax allowance in the year that you're working, it's basically impossible to work out what your annual allowance is going to reduce to. So you can't actually pre-plan, and I'll go on to raise some of the examples of GPs and consultants in my own constituency, and I know there's members here who've been contacted from their own who will highlight some particular examples of this. And absolutely.
I've had a constituent contact me who tells me that he's been advised to take early retirement to avoid taxes. Does my honourable friend agree with me that retaining long-serving consultants in the NHS who bring experience in their fields is vital for the success of the NHS?
My honourable friend is absolutely right, and this is why this is really important. I'll come on to talk about this a bit later, but I appreciate, we know we're talking about people here who do earn a lot of money and who do have good pension schemes, but the potential knock-on in terms of very senior doctors turning down hours or taking early retirement could be a very significant issue.
Thank you.
Extremely grateful to him for giving way and for allowing me to intervene. And following him securing this debate, I received an email from a consultant who works in my constituency, and he informed me that one of the unintended consequences of this new arrangement is for him to reduce the amount of hours he's working in the NHS.
Exactly right, and I think it's really important. I mean, I did apply this for a Treasury Minister to come. This is ultimately a Treasury issue in terms of the underlying legislation, but I think it is actually really important to have a Health Minister here today to hear more first-hand of the stories that are being raised with local MPs, because in recent months, it has become increasingly apparent that the pension tax rules are resulting in unexpected tax charges being levied on a large number of GPs, senior doctors, surgeons and consultants right across the UK. And I believe that if not addressed, serious capacity gaps which exist in the NHS will only be made worse. In Scotland, 7.6% of consultant posts are vacant, and more than half of those have been vacant for over 6 months. And there's a similar picture in the NHS and in all other parts of the United Kingdom. And a recent survey by the Hospital Consultants and Specialists Association found that over 40% of doctors questioned said pension taxation changes had led them to change their plans to retire earlier than expected. The way in which the tapered annual allowance operates means a significantly reduced annual allowance ceiling is hitting many of those NHS professionals I mentioned and the honourable member for Strangford mentioned in their mid to late careers. And because their entire income is taken into account for the purposes of tapering, that threshold can be breached even by doing non-pensionable work, including covering for absent colleagues, extra programmed activities or waiting list initiatives. NHS staff on PAYE cannot avoid the notional pension input amount calculation, and as a result, many consultants are being hit with unexpected five-figure tax charges. A number are now dropping extra work, turning down hours, or indeed going part-time to negate or avoid these penalties. Now, of course, high earners should pay their fair share, and all the doctors who have contacted me want to do so, but they are paying rates of over 60% as a result of the taper, and some are paying effective rates of over 100%. Many consultants who continue to do non-pensionable overtime are effectively paying the government to go to work whilst receiving no additional pension benefit. Of course.
Right Member for Giving Ways, making a very powerful forensic speech on this critical issue facing the National Health Service. Several of my constituents have been in touch about it, but one in particular, a consultant, mentioned that actually the impact of this in NHS Greater Glasgow and Clyde will be huge, because waiting list initiatives actually ensure that the Health Board isn't penalised with penalties. So actually it's militating against efficiency in the National Health Service and actually costing more in the long run. So it's a total false economy. Surely the Health Minister could take action here with the Treasury to get this sorted out quickly.
I thank the Honourable Member for that intervention, and he raises a good point. Of course, in our constituencies we share a health board, and actually all the specific cases I'll raise are for people who work for NHS Greater Glasgow and Clyde, and we see exactly the sort of consequences and knock-on effects that he is highlighting. One surgeon contacted me to tell me he was hit with a tax bill of £62,000 because he received a national award. So people who receive a bonus or a pay rise can find themselves with a whopping tax penalty as a consequence. And because of rigid pay and pension rules in the NHS, the ability to mitigate the issue is pretty much non-existent, certainly compared to people in the private sector, because there's not the flexibility to reduce contributions or request cash in lieu of pension if there's a danger of breaching the allowance. The only option, as we've heard from members in their examples, is to opt out of the scheme altogether or drastically reduce your working hours. And that means the issue is fast becoming a huge driver, not only of early retirement, which is in itself extremely serious, but of forcing reduced working hours, impacting on NHS care and creating loss of capacity. The reality is that waiting times, a problem in a variety of areas across the UK, are hit because of these perverse rules that mean consultants refuse the overtime needed to help clear the backlog. The investigation by the Financial Times found the issue had increased the risk of delays in cancer diagnosis in some parts of the UK and had lengthened waiting times for procedures such as hip replacements. Critical areas such as intensive care and radiology were also being affected. One consultant said that around 50 fewer patients were being seen per week in the cancer clinics they cover as a result of doctors turning down extra shifts. One consultant living in my constituency contacted me following receipt of a tax charge of £29,000, despite doing no work outside of the NHS. He told me he will now have to drop a session of clinical work to try and ensure this doesn't happen again. He's now actively considering early retirement, having reluctantly started to reach the conclusion that there is no incentive for him to continue his career beyond the age of 60, and has been forced into this position by the clear unintended consequences of the pension system. I'll give way to my honourable friend.
Very grateful to my honourable friend for giving way, and I congratulate him for securing this debate. And I think the appetite today shows that there's probably more support for this, perhaps in a backbench business debate. But he is absolutely right to highlight the huge financial penalties that people are incurring. And in the case of one of my constituents in Brackney, he's looking at a £15,000 bill just at the end of January. Now that is something that is not helpful. He's already told me he's planning to retire early. Surely this only makes the case that the government need to take action on this.
Yeah, I thank my honourable friend for raising another very specific case, which I hope the Minister will bear in mind in terms of the added weight of evidence for that. And another of my constituents, who's worked as an NHS consultant for 14 years at the Queen Elizabeth University Hospital in Glasgow, told me that he's employed on a 40-hour per week full-time contract, and in addition provides 8 hours per week of additional clinical work, so 48 hours in total. He doesn't do any private practice outside the NHS, but as a result of the tapered annual allowance, he was hit with an unexpected tax bill of nearly £17,000. And the only way this consultant can avoid these charges is to reduce their income below the various thresholds, and the only way they can reduce their income is to reduce the amount of work they do for the NHS. He's told me he's got no desire to do this, and indeed would happily volunteer to do extra work occasionally at weekends to tackle waiting lists or fill gaps in the service. But the tax implications make that impossible, and they've stopped doing any extra work already. Another consultant from East Renfrewshire with 16 years' experience, 8 as a consultant, told me he was actively declining extra work to support stretched services to avoid the tax penalties. This also means he doesn't apply for the discretionary points that are awarded for additional work taken on above the normal daily remit, such as developing new services, research and teaching. So this impacts, as the Honourable Member for Glasgow said, not just on the daily running of services, but in terms of the development of culture of excellence within the NHS. A recent report showed that 50%... Yes, of course.
I thank my old friend for being around. I do apologise for missing the first couple of minutes of this debate. He's a great thinker on pensions, so maybe actually I wanted to come in today. I just want to ask my old friend a very simple question. Does he wish to dispense effectively with the annual allowance and lifetime limit, or does he want a special dispensation for senior NHS workers who are also quite high income workers? earners?
I thank the Honourable Gentleman for that question and his kind comments. They were undeserved. I think there's a wider issue here actually with the general complexity of the systems of reliefs and allowances within the UK pension system. And actually what I hope this will be is not necessarily something for one single dispensation for one area of the public sector, but the start of an understanding and a recognition that we need to actually look at the way the system is operating more generally and look at some of these allowances and reliefs, work out whether actually they're necessary, whether they are effective, and whether or not they should be subject to some kind of broader level of review. A recent report showed that over 50% of those asked reported using the NHS scheme pays facility to pay off their unexpected tax charges. However, this doesn't work for all cases, and the amount is effectively treated as a loan, which is then paid back from the retirement benefit with interest charged against the pension at high rates. So that means it's usually costlier than paying up front, particularly for younger members. And I do fear that this issue could see us sleepwalk into a deepening workforce crisis in the NHS, and could result in consultants leaving the NHS early when they still have the skills and experience we need. These individuals are important not just for patients, but for junior doctors in terms of the training and mentoring they receive on the job. The BMA firmly believe that long-term changes are required to the pensions taxation system in order to remove the disincentives that exist, and I would certainly agree with that. The Commons Library's excellent briefing on pensions taxation makes reference to the impact of changes in the annual allowance on the public sector, and notes that in its 2017 report, the Doctors and Dentists Review Body requested more evidence about the impact of the annual allowance and lifetime allowance on early departure rates. The Treasury indicated it would consider revisions to the NHS pension scheme if there was evidence that the number of doctors and dentists taking early retirement as a result of its inflexibility was substantial. So I would like to ask the Minister a series of questions, and I appreciate that she might not be able to cover them all today, and a number of them do fall within the remit of the Treasury, but hopefully she'll be able to take those away and arrange for either herself or a Treasury Minister to get back to me. Firstly, what discussions were had by the Treasury with the Department of Health when the tapered annual allowance was introduced, and was this ever flagged as a potential problem? Secondly, what evidence has the Treasury collected on the number of doctors and dentists taking early retirement following the 2017 report? If the answer is none, why is that the case? And when will analysis of the impact on changes to the lifetime and annual allowances on the NHS be carried out? If evidence has been collected, what were the findings of that analysis, and are there any changes being considered? Thirdly, what consideration has the Treasury given to a review of the annual allowance taper more generally, perhaps as part of a wider review into simplifying the incredibly complex system of reliefs and allowances in the UK pension system? And finally, have there been any discussions by the relevant government departments with the relevant parties on whether permitting more individual flexibility within the NHS pension scheme could be a solution? That's something that's being called for by NHS employers. Whilst this issue is not specific to the NHS, and I've already heard in recent days from armed forces personnel, for example, it does appear to be an area with a particular problem. And whilst I appreciate many will not hold great swathes of sympathy for individuals on such high earnings, and who will still be getting very strong levels of retirement pension most of our constituents could only dream of, the reality is if this results in much needed expertise of consultants turning down work or leaving the NHS altogether, that will have major implications for the provision of services and the quality of care our constituents right across the UK receive, whichever colour of government is in control of their NHS. Now, I'm sure that the Treasury did not intend these changes to force experienced, committed consultants, surgeons and GPs to do less work for the NHS, but this is the reality being faced within the hospitals that serve my constituents and, I'm sure, the Ministers. It is good that the BMA and NHS employers recognise this as a serious concern and met last week to discuss, but they haven't agreed a solution or a joint action plan, and in reality the ball is in the Treasury's court. And I absolutely respect and agree with the Government's position that we need to get the balance right between encouraging saving and managing government finances, but I don't think that this is an issue that can just be easily ignored. Legitimate aims to restrict tax perks for the wealthiest in society are exposing ever-increasing numbers of long-serving and highly experienced NHS workers to massive tax charges. If we want high-quality care in the NHS in Scotland and across the UK, we need senior doctors who have devoted their professional lives to the care and well-being of our constituents. It is ludicrous if we face a situation where the pension system is acting as a disincentive and effectively forcing consultants to choose between working for nothing and patient care. I hope that this debate provides the first opportunity for us to say clearly that, whether the answer lies in adding flexibility to strict NHS pay and pension terms, or with the Treasury using this as a reason to take a fresh look at the ridiculously complicated tapered annual allowance, this is an unintended consequence of the UK's complex pensions regime, which we need to sort out quickly to let these consultants get back to work. Thank you, Sir Roger.